Okay, for more insight into AI's potential in the elder care market, we're joined by Xi Chen. He's an associate professor of health policy and economics at Yale University. Great to have you on the program. Thanks for coming on.
Glad to join you, Sean.
What does this information show us about how seniors feel about AI tech? Your thoughts. Do you believe that most seniors are going to be receptive to this or reluctant, want the human touch, so to speak?
Yeah, globally, I think seniors exhibit a mixture of curiosity and caution. They tend to open to its potential, especially in enhancing daily life and health. But they have significant concerns about privacy, usability, and lack of trust. We know across countries, there are more higher and higher awareness of AI technology being implemented in the nursing industry. But the large number of people are undecided whether to use. And in the field, we see that only a small proportion of older adults are actually using that, but the number is growing quickly.
Yeah, I think that's the thing, the potential. But the question then becomes, how much data sharing is too much? And what kind of safeguards are there out there to basically, limit the information that is shared with these robots to strictly essential for them to complete their tasks?
Yeah, I think this is a greatly important question. There has to be some thresholds about which it can be too much of data sharing. For example, every kind of data use access should be like within a context. For example, home assistant robots, like those with smart vacuum cleaners, social robots, might not need access to personal health or financial data, right? Industrial robots usually work with operational data, but not personal information. And also we need to pay attention to data sensitivity, highly sensitive data, for example, biometrics data requires strict control, and also retention and purpose has to be implemented. And data should only be collected for certain defined task, stored temporarily, but deleted afterwards.
You know, the robots are neat, they're fascinating, they're great to look at, but aside from robots, what other ways is AI technology being used right now to help care for the elderly? You said it's really growing rapidly.
Yes, in our work in Japan, in China, we see that the robots and the non-robots automations have been implemented. They include monitoring, mobility, toileting, bathing, transfer of patients, and sometimes communications. And I think aside from robots, more like automations have been used or AI technology being used for communications. For example, they combat loneliness and enhance mental health of older adults. For example, some platforms in America here, the elder connect older adults with their children, addressing isolation and fostering purpose. And some pilot programs in New York City, we observe, provide seniors with AI-powered virtual companions via the TV-based platforms, like offering daily interactions, medication reminders, and cognitive exercise to support aging in place. And our ultimate goal is to age in place.
You know, it's interesting. It's almost like you can see my notes, because I want to talk about the cognitive abilities, because a lot of people my age are dealing with elderly parents. And as they have trouble remembering facts, begin the early set on of dementia, a very difficult time for families. How can AI technology aid in caring for that?
Right. I think for patients, there are three things we can do. First is the personalized care monitoring. For example, the AI-driven wearables can monitor daily activities and detect the behavior changes. For example, the older adults skip the meals, which can alert the caregivers. And the second is early diagnose and predictive tools. The AI tools can analyze the people's speech patterns, such as pauses and word repetition, to detect early signs of dementia. And now the accuracy rate is getting higher and higher, around like 90% accuracy. And the third is companion robots and social interactions, which can respond to touch and sound, reduce agitation, and improve mood for dementia patients. And lastly, but very importantly, they can support caregivers. We know that AI platforms offer caregivers training, reminders, and tools to monitor patients' behavior, reducing stress and improve care quality.
We have time for one more question. I'm curious where you see AI technology going in the next 5 to 10 years. How could it really benefit elder care?
Yes, I see that for different diseases, the development stage for AI tools are very different. For example, for stroke patients, some clinical trials have been ongoing for computer chip implants. But for Alzheimer's disease, dementia might be a little bit early because the neurological disease can be more difficult. It's not like only affecting a localized brain area, it's affecting the whole brain tissue and the brain degeneration. And we have no idea about the exact mechanism. And also there's ethical concern, safety concern, because unlike other diseases, dementia, the memory loss, is something that the elderly lose control of themselves, and that they have no consent about anything we want to impose them, right? And the lack of autonomy, and there's a data privacy issue. So those are lagging behind other kind of diseases, AI technology implementation. But I think in general, there might be something like, for example, the early detection of disease can be more and more widely available for different kind of diseases, and non-invasive interventions can be available for diseases control and management in the next 5 or 10 years.